Oklahoma, we are here today to announce some really good news. We have entered the last phase of our COVID-19 plan. This means all Oklahomans 16 and up are eligible to get the vaccine. This is really, truly an incredible milestone, and we are one of the first states in the nation to get here. From the very beginning, I cast the vision to all of Oklahoma and to our healthcare department that we want to lead the country in vaccines administered. And I want to thank our team, all the hard work, Dr. Lance Fry for all the work you've done to make this possible. Keith Reed, thank you so much. Our state and local health departments that have worked so hard. The National Guard has been an instrumental part of our planning and execution of this process. And really, all of our healthcare partners across the state have done a tremendous job. So thank you. This truly has been a team effort. Many people have worked long hours, days and nights, for months, really, to make this happen. So I'm so proud of them, and I know Oklahomans are so thankful for the hard work that you guys have done. We are closing in right now on 2 million vaccines administered in the state of Oklahoma. Truly remarkable when you think about it's only been 3.5 months since we started rolling out the vaccines in the state. About 85% of those doses have come through our state and local health departments. 11% came from tribal partners, and the rest came from other federal partnerships. So it's truly been a team effort, and each dose matters. Those vaccines are truly protecting the health and lives of so many Oklahomans. We're seeing the results in our data. Today, we've had just 194 new cases in the state of Oklahoma. Our 7-day average is the lowest that it's been since last June. New cases in Oklahoma are down 92% from their peak just back in January. They're also down 37% since my latest executive order on March 12th. Hospitalizations, they're also down nearly 90%, and they're at their lowest levels that we've seen in the last 9 months. So we are going to get our summers back, Oklahoma, and the light at the end of the tunnel has never been brighter. And now I'd like to turn it over to Keith Reed to give you an update of what Phase 4 looks like. Keith?
Thank you, Governor. I first want to give you an update on where we are in our vaccine distribution. The total vaccines administered in Oklahoma, including both state and federal allocation, is 1,888,004 doses. We have 1,201,827 Oklahomans who have received at least one dose, which equals just over 30% of our state's population. 685,348 Oklahomans have completed the series. 73.2% of Oklahoma's 65 plus are now fully vaccinated. 65 plus are vaccinated with at least one dose. Appointments are now open in the state's vaccine scheduler for all adult Oklahomans who are eligible in phases 1 through 4. Appointments are also available through our pandemic provider partners. In fact, vaccine has been put in the hands of over 1,000 providers since this effort began, and we are adding more each week. This monumental milestone in the state's vaccine rollout is reason to celebrate. We've gotten to this point thanks to the hard work of our public health staff at both the state and county levels, and our many partners around the state, including numerous hospital systems, medical providers, pharmacies, tribal health systems, and the Oklahoma National Guard. Thank you to all of them and to the countless others who have stepped up to take on this incredible challenge. As we've opened up the vaccine to more and more of our residents, it has been exciting and encouraging to see more and more of our friends, family members, and neighbors receive their vaccines. As excited as we are to move into this final phase, we must not declare this endeavor over. There are still many Oklahomans that must get vaccinated if we want to truly put COVID behind us and keep it there. I want to encourage everyone yet to be vaccinated to schedule an appointment as soon as possible as we look to continue making progress toward a new normal. The vaccine is free to all Oklahomans. Again, there are appointments available across the state, including our metro areas. So if you haven't registered in the state portal yet, I highly encourage you to do so. And as a reminder, the state portal is only one method to obtain an appointment. Please continue to check with our other pandemic provider partners, including portals through pharmacy systems, hospital systems, and others such as Emmy Labs in the metro areas. You can also check with your personal provider or use the federal tool vaccinefinder.org to check for vaccines available near you. To clarify, anyone over the age of 16 is eligible to receive the vaccine right now. You can receive the Pfizer vaccine if you are 16 or 17 years old with parental consent and with a parent or guardian present at the appointment time. You must be 18 or older to receive the Moderna or Johnson & Johnson vaccine. You should also plan for your second shot if you receive the Moderna or Pfizer vaccine. You need both shots to be fully protected and to protect others from COVID-19. I do want to note that you can and should still receive the vaccine if you've already had COVID-19. The only criteria is that you wait until you have recovered and no longer meet criteria for isolation. Note that it is no longer our recommendation that you wait 90 days after infection, as that recommendation was related to limited vaccine availability. Otherwise, if you've been waiting to receive your COVID-19 vaccine, the wait is over. Now is the best time for you to get the vaccine. It is not only the best way to protect yourself from the virus, but it is also an unselfish act to protect your loved ones and your community from COVID-19. With that, I will turn it over to Commissioner Fry.
Thank you, Keith. It makes me very happy to see the progress we've made in pushing back on COVID-19. And I'm proud of the hard work of our agency, our partners, and fellow Oklahomans. But our work isn't done yet. There are still many around us who are not vaccinated. You're going to hear me repeat a lot of the things that you've heard just a moment ago because it's really important that we get this information. Let's continue to mask up in public places and be mindful of the CDC's recommendations as the remainder of Oklahomans schedule their appointments. Now is the time to get the COVID-19 vaccine. We have opened appointments across the state, and if there are appointments near you, I urge you not to wait. I strongly recommend all Oklahomans consider getting the vaccine. Let me be clear, this vaccine is very safe and it works. The vaccine prevents you from getting seriously ill or dying from COVID-19. With FDA authorized vaccines from 3 manufacturers available, I want to emphasize that the best vaccine is the one you can get now. All 3 will work to keep you safe. Building personal immunity and herd immunity are key to helping us get back to our new normal. If you've gotten the vaccine already, please remember to still be cautious when you gather with others. Before gathering with friends and family, remember that it takes about 14 days following your final dose for your body to produce an effective immune response. If possible, wait the 2 weeks to gather with others, especially if they haven't received the vaccine yet. New CDC guidance recommends that fully vaccinated people can omit wearing masks if they're visiting indoors with small groups of people who are either fully vaccinated or from a single household and at low risk. If you choose to gather with any number of people who have not been vaccinated, you should still wear a mask, wash your hands, and watch your distance. Especially as warmer weather approaches, we encourage people to participate in outdoor activities when gathering with family and friends. If you're still waiting for a vaccine appointment, remember that now is the time to get it. Remember to practice the 3 W's while you're waiting. Wear a mask, wash your hands, and watch your distance. We're nearing the finish line, and it's important that we don't take our foot off our gas as we approach it. Before I turn this back over to Governor Stitt, I'd like to thank 2 of our public health nurses who are here with us today, Marcia and Amy, who represent thousands of public health care nurses across the state who have been on the front lines fighting this pandemic and working every day to get Oklahomans vaccinated. Thank you for your tireless efforts and for being here today. Governor Stitt?
Thank you, Dr. Fry. Thanks, Keith. As I said earlier, I am so proud of our health department and all of our partners across the state of Oklahoma for all their hard work, and Oklahomans, thank you as well. We were one of the first states to make this vaccine open to everyone, 16 plus. Oklahoma, we did this the right way. We prioritized the people who needed it first. We protected our most vulnerable. And today we have enough supply that anyone in the state of Oklahoma who wants a vaccine can get it. Because of that, I'll be receiving the Johnson & Johnson vaccine right after we finish the press conference today. You're welcome to stick around and watch if you'd like. And with that, I'll open it up for a few questions. Well, like I've said from the very beginning, we'll make the right decisions at the right time in the state of Oklahoma. We have the lowest cases that we've had since last June. Hospitalizations are now 90%. So, of course, we'll keep monitoring it, but it's the right time to keep the momentum that we have and keep everything open.
Are you seeing, if that's okay, are you seeing anything that would make you nervous about a spring spike of any kind? I guess I don't understand why we're not seeing that in some East Coast states.
Well, I can't really answer that question, to be honest with you, the specific reason, but we are watching the numbers, and we haven't seen them increasing yet. We were just talking before this meeting that we still have a couple of weeks watching that to make sure and see what happens. But right now, we haven't seen those increase in numbers, but we're going to just keep watching it closely.
We're in a bit of a predicament. At 5 o'clock, we're going to have this story. At 5:30, we switch over to national news. Who's going to have the CDC director in tears, warning of, quote, impending doom. This gets so confusing. We hear the sunshine and rainbows here, and we've got the storm clouds over there. Well, who do I need to believe? Did we buck the trend that much that we're different?
I would say, the truth is in the numbers, in the data. Oklahoma is slightly different than the coast. We don't have population density. There are a lot of other reasons that it probably affected us less. I think in retrospect, we'll look back on this and say that overall, we fared better than a lot of other states through this process. But we just have to keep watching it closely and be ready to take action if it's needed.
To get the vaccine now with the partners, is the goal at some point to go into individual doctors' offices, or is that an option down the road?
It is, absolutely, and I'll let Keith talk a little bit more about that.
So the way we set up this program is we encouraged private providers, health systems to sign up as pandemic providers. They enter into an agreement with the State Department of Health and a CDC to follow certain guidelines on the administration of vaccine, tracking, storage, et cetera. We've had about 1,600 sign up. We've had vaccine in the hands of over 1,000 right now. This next week, we have invited the remaining ones to submit orders for vaccine. So they submit orders, we'll get vaccines into their hands, and that'll create more access points around the state. And then we're encouraging other providers to reach out and continue to sign up as pandemic providers. If they are interested in signing up, we can get vaccine to them.
Johnson & Johnson arrived on schedule, and is that now a rolling delivery as opposed to that 1 month chunk we got first?
Sure. So when Johnson & Johnson came out, we got one good initial shipment, about 33,000 doses. And then we saw a couple weeks of, next week we didn't receive any, then about 4,400. We're up this current week we're in, we're going to be back up to around, I think it's 22,000 doses. So we are back on the increase on that, and it will come in weekly. Yes.
Governor, my question's for you. What is your response to last week's law 44 claiming that the contact tracing here in the state was insufficient? And piggybacking on that, what is the state's plan moving forward as far as contact tracing and COVID reporting and collecting data?
Yeah, I'm going to let those guys answer the contact tracing.
First of all, in just another response to both of your concerns earlier about that. The best thing we can do right now to protect us from another surge is for everyone to get vaccinated. So we really, really need to encourage that. We have plenty of vaccine in the state now. The supply is coming in on a regular basis, and we have open appointments. So just people get the message out to get vaccinated. In response to the Loft report, contact tracing throughout the United States was ineffective. Once the numbers reached a certain amount, the labor involved in doing contact tracing just overwhelmed the systems. And so our situation is no different than any other state and was not a surprise. I mean, we already knew that. We'd already decentralized our contact tracing and started looking into different technology that have come out since the beginning of the pandemic in order to help us prepare for the future. I'm sorry, there was a second part to the question, which I don't.
What is the state plan moving forward as far as contact tracing is concerned and COVID data reporting?
As far as COVID data reporting, we're looking at the future of public health in the state, and we're trying to update all of our technology, and we're looking at systems that will all work together, and so that it's not as big of a manual lift throughout with all the processes that have to go through to do it. So the future of it is hopefully to be able to report. It'll never be real time, but as close as we can be in a much more automated way. For now, we're reporting weekly because our numbers are down enough to where individual numbers per day don't really have a lot of meaning. 7-day rolling averages mean more, but we can always, if our numbers go back up, that's an easy fix. We can go back to the way we were before. So.
You gave us a lot of, I'm sorry.
So, I know you're getting the J&J shot today, so obviously that'll be a really niche for people. But some studies and surveys have shown that among various groups, it's Republicans or white Republicans, particularly who may be hesitant about getting vaccines. So the red state governor, to give somebody across from you, it's like, I don't know, I don't want to get it. What's your message to them, and what's your encouragement?
Well, you know, I'm trying to lead by example, and so that's why I'm doing it today. We think all 3 of the vaccines are safe, and that's why I'm stepping up. As soon as they're available for everybody, I wanted to wait till, our most vulnerable had the choice, but now that we're at phase 4, I'm going to lead by example, and I'm going to do it. And but again, we're not going to mandate anything. We're not going to require that. This is a personal responsibility. That's what we believe. And but I think by me being here as the governor of a state like Oklahoma, then hopefully I can encourage others to follow my lead. And like Dr. Fry said, we think this is the right thing to do to continue to keep those cases going down.
Governor,
Yes, sir.
I have a question for you about last week's decision from the Board of Education regarding charter school funding in Oklahoma. I saw today you were on a press release saying celebrating the decision before the vote, and I wanted to ask, why do you think that decision was good, and what do you say to those, including the superintendent, who said the vote was not lawful and not constitutional?
Yeah, well, first off, Oklahomans need to understand charter schools are public schools, okay? So that's the first thing. I think the board made the right decision. If this pandemic has showed us one thing, there's not a one-size-fits-all approach to education. Parents were frustrated, but this issue particularly has been a problem long before I was governor. But the charter school students and public school students, we believe that they deserve every access, every opportunity that everyone else does in the public school system here in Oklahoma.
Did you, before making your appointments to the Board of Education, did you at any point discuss this lawsuit with those individuals before you appointed them?
Not that I'm, no. No, the answer is no.
You guys gave a lot of numbers on how many have been vaccinated and all that stuff. Where do we stand? What are initial projections on how many would want the vaccine? Are we exceeding? Are we below where you guys thought the acceptance level or people would want to get the vaccine?
So the At one point, the surveys were showing about 66% of Oklahomans said that they were interested in taking the vaccine. We're obviously not at 66% yet, so we still have a ways to go. And that's something we've got to keep working towards and keep moving towards a vaccination program that will get us much closer to herd immunity. So we're not there yet. We got to continue to offer vaccines. At this point, we're entering this phase 4, where we're going to make it available in as many areas as possible. We're going to remove as many barriers as possible for people to get vaccinated. And hopefully vaccine hesitancy, which is really what you're asking about, is something that we don't need to worry about right now, and that's to be something down the road. But the biggest thing we can do right now is just encourage Oklahomans to get vaccinated so that we can get COVID put behind us. We want it behind us. We not only want our summer back, we want the fall and the holiday season back as well. So a vaccine program is the way to get there.
Talk about how there are clinical trials right now for children's vaccine. It doesn't talk about how to roll that out, but I imagine it might be smoother instead of in phases. Is there funding underway?
So the first part of your question is, yes, there are studies underway right now with the existing vaccines to check out their safety and efficacy in children in different age groups for those under 18 or 16, if you're talking about Pfizer. We have plans of how we can go about and vaccinate school-aged children. They'll be part of the expansion of our vaccination program. And that's really what we've done throughout this. We've evolved our program based off of the needs and the different trends of Oklahomans needing to get vaccinated. So we will continue to moderate and alter our plans. The health department does back-to-school vaccinations all the time. So we're adept at setting up vaccination programs for school-aged children.
So there's not going to be a phase 1 for the sophomores and freshmen?
I don't anticipate that because the phase program was about supply. We knew at the beginning we were going to have very limited supplies at the beginning, and that we would evolve as we went through that. So in order to kind of manage that demand and ensure that we were providing the supply in such a way that did the most good for Oklahomans, we set up that phase plan. When we start to get into a program for those under 18, supply should not be an issue at that point.
Do you have any statistics on the number of teachers who took the vaccine when they were opened up for phase 2?
So I don't have specific numbers across the board. Anecdotally, from different school systems, we were seeing a pretty wide range, from 55% up to 80%. It really depended on school districts, but we did not track it across the board as teachers in general. And then, of course, we continue to offer to teachers. And that's the important thing about what we said all along. If somebody decides they don't want to take it today, that doesn't mean that we don't make it available to them in 2 weeks. So we continue to encourage people that have chosen at this point not to get vaccinated to reconsider their decision and know that it's easy access, and we'll be glad to vaccinate them now.
All right, y'all need to go change your shirt and come back and we'll do this.
So he can face.
Okay.
And I can, it was arm, because he'll have it raised up. Okay. Do you want me to hang on to this, or do you want me to set it? Hello.
Have you done this before?
I have maybe
Okay.
once or twice.
He has done it so much.
I'm more nervous than anything right now. All these cameras on me.
It'll be quick.
Tell-
I didn't even feel it.
So my name is Marcia. I'm one of the nurses at the health department. So I'm going to administer your Janssen, your Johnson & Johnson vaccine.
Okay.
Can you move the red box?
Okay.
Here, just set it down.
Okay. If you can actually hold your sleeve up. Okay.
Oh. Anybody not like shots here?
Don't worry. Just put that. Basically, bandage on there. Injection free.
We could pepper you with questions about state policy.
Huh?
Hold your sleeve up. That's it.
Done.
Okay. It wasn't bad. Thank you. Thank you. Thank you so much. Appreciate
You're
it.
most welcome. And here's your card.
Okay.
That's it.
Great, so, this is a 5-dose vial. We just gave one, so we have 4 more doses here. If anybody would like to get vaccinated, we have 4 doses before we take them back to the health department.
All right.
Okay.
I'm signed up for Wednesday, but